So the tear trough's an interesting one because it happens actually not just in older people but in young people too, that you get a shadow that develops underneath your eye. Unfortunately, the shadow is associated with tiredness and people therefore comment on it. So it's quite common for people to request to have the tear trough treatment because their friends and colleagues keep asking them why they're so tired and they're not tired. So it becomes annoying on a daily basis. They feel like there's an issue that's a distraction for them and they'd like to be free of it. And that's the typical reason people have the tear trough treatment. The treatment is given through a very small needle and is placed underneath the muscle through little injections that instantly lift up the surface of the skin, which means it doesn't catch the light in the same way and it gives you the clarity that people are hoping for. So it gets rid of the shadow and lasts about 12 months. Side effects with this treatment are actually mainly due to how it's given. So because it's placed under the skin with a needle, it's possible, like with all injections, to cause a bruise, and that would be the most common side effect. What that really means is a small, faint blue bruise for most people, which lasts about a week to 10 days. But for some people, it can be a little bit bigger and last a little bit longer. The only things we can do to reduce that are to just inject very slowly and be gentle. As you can see from the procedure, we're very, very delicate, and this is all to avoid bruising and to maintain the maximum amount of control so that we get the very precise result that you need to get the best possible outcome. Interestingly, it's one of the least painful procedures that we do, and this is always a surprise to people because they think it being near your eyes would be one of the worst, but actually the skin is quite thin. There aren't that many nerve endings to it, and because it's done so gently, it's actually particularly comfortable as far as injections can be. It's a very common treatment for us to do at SkinViva. I think we're one of the country's busiest clinics for doing the tear trough. We do about 60 a month at the moment, so for us it's quite common, but I think if you look at the medical aesthetics in general, it's a less common treatment. Aftercare is quite simple. All you need to do is avoid putting pressure on the area and too much movement. So we always say avoid vigorous exercise, a lot of alcohol, or anything that would make your face more active in that area. So just take it easy for 2 days. By around the 2-week point, you should have fully recovered from the procedure and are hopefully just enjoying the results. So that means you should be free of the little issue that was bothering you and just carrying on with life as normal. This treatment is right for certain people, but not for others. So the best thing, because there are a lot of variables in this treatment, is to have a consultation with one of our doctors. There are certain cases where you are almost certain to get a great result and certain cases where the result might be softer. And this requires a good explanation with you with one of our doctors so that you can understand why. I think the most important thing to look for, particularly with the tear trough treatment, is that someone is doing a lot of these procedures. It is a relatively tricky procedure because there's very small margin for error because the skin is very thin. So little imperfections are more obvious in this area than in other parts of the face. So I think one of the best guides is how many procedures are being done. It is possible to have surgery to help this area, but I'd say most of the cases we treat would be better with an injectable filler rather than surgery. And there are a few cases where people don't want surgery, where a little bit of skin being removed or a blepharoplasty is actually a better solution. And we would give you some of that advice if you're not sure which category you fall into at your consultation. The biggest improvement people notice is they just, for example, love putting their makeup on because it just makes them look so much better straight away. And actually, interestingly, thinking about makeup, that's actually also one of the things people say they don't need as much of. So they feel more confident without trying to cover the blemish with makeup, and they just feel a bit freer to carry on with their day and get on with life without worrying about the issue that they had.